We're going to now move on. So thank you again. We're now moving our journey to Canada, where you're going to gain many more insights from our next speaker, Brock Hart, the co-chief executive officer at Overlap Associates. Brock is an award-winning designer and a serial entrepreneur focused on helping organizations embrace innovation through design. Brock leads the transformation design team at Overlap, and he's going to speak about his work with Canadian children and youth. The title of this presentation is My Cat Makes Me Happy, Designing with Canadian Children and Youth. Brock, the floor is yours.
Thanks so much. And thanks for having me this morning. We always like talking about this work that we do here. Just for a little bit of context about Overlap, we think of ourselves as a problem-solving company. We have three sort of parts of that company. So the design consultancy, which is what I'm going to be talking about today, does design thinking work with all types of organizations. We also teach creative problem-solving skills to organizations, because a lot of our belief is that if we can build capacity in organizations to work this way, to engage with the people that they are serving, they will create better outcomes for them. So we teach, and then we also we have a product division that creates products to support people in their problem solving and to apply this way of working. It's been interesting listening to the previous speakers. A lot of themes around who gets invited, who gets to participate, who's involved. And Overlap has been around since 2011. We have studios in Canada and the UK. And so much of our philosophy has been about trying to help the organizations that we're working with share power with the people that they are trying to design with. And of course, they would typically be thinking about it as designing for them, but of course, we should be designing with people. So I'll just give two quick examples of that before I talk about some of the work we've been doing with UNICEF Canada with children and youth. One of our earliest projects was working with a hospital here in Canada, and we were looking at the patient experience generally. Just what is that patient experience? How might we improve it? And one of the things that emerged through that work, engaging with patients and families and frontline workers, people in community, was a desire for dignity in death. That dying is scary. Dying happens all the time in hospitals. It's a very normal part of what happens there, but we don't talk about that part. My expectation when I go to the hospital is that I will go and I will get better and I will come home. But of course, lots of people pass away and we don't talk about that. We're really bad at talking about death. So when confronted with this desire and this statement and this insight from talking with patients and people in hospital about wanting a more dignified dying experience, we co-designed with patients and families and frontline workers a no one dies alone policy, where anyone from the administration to the cleaning staff were empowered to sit with someone, hold their hand, and be with them if you realize they were in their final moments and they were alone. And of course, all of the consents and all of the things that need to go along with something like that were part of what got designed. But that policy that got put forward within that organization was absolutely transformative for them. And one of the things they realized in healthcare settings, we are absolutely drowning in data, but we are thirsty for insights. We measure all kinds of things in healthcare. We ask you to, and all kinds of patient satisfaction stuff gets done. So did you feel included in your care? Was the food okay? How clean was your room? Were the staff nice? But we never ask you to rate out of 5 how scared you were. We never ask you to rank out of 5 how dignified the experience was. We never ask these types of questions. And because we don't ask, we never actually address those things. So that project allowed us to highlight something that wasn't being talked about, and they created a very specific intervention that has been, again, as I say, transformative for them. And we don't have any data. We have no post-death surveys from individuals saying that that was a more dignified dying experience. But we all understand on some human level that, of course, it is. And so, again, I think sometimes there are moments where we absolutely want to be data-driven. We absolutely want to have evidence. And sometimes there is a human response and a human solution that we all can understand that there's a collective humanity in. It's nicer to die with people around you than to die completely by yourself. Another example of us doing this kind of work and really co-designing and trying to share power with people is work in mental health. Oscar, I would love to have so many more conversations with you about the work that you've been doing. We do a lot of work in mental health and addictions spaces. And one of our projects was working with a big health system and the mental health system specifically, and again, looking at the patient experience there and doing engagement with folks that are homeless or street involved, have severe mental health challenges and issues, often bump into the justice system as a result of that, and trying to understand what their lived experience is on a day-to-day basis. Their intersections with the healthcare system are a sliver of their life, obviously, and there's all the other systems that they bump into. So we had the privilege of a client that allowed us to go and just engage with people where they were and really create a holistic experience of their life and to look for ways that might be able to be improved. What emerged again from that was a desire for dignity and service, that they wanted to be treated like human beings, that people wanted to be seen as a whole person. Again, these are all really understandable things, but people get defined by their mental health issue or their addiction issue. And what was co-created there with patients and their families was a service policy and a service standard called Dignity by Default, which was saying, again, that I get treated for my healthcare issue as table stakes, that you treat me like a human being is the thing that we're missing, and that the reason why I don't go to my appointment is because of the stigma I feel. And so it was 17 principles that organizations were able to apply to their services and either refine a service, or if they were designing a new service, in applying these, they were creating a more dignified experience for people, a more human experience for people. So those are some of the things that we used to do early days. We continue to work in a whole variety of spaces, but the work I wanted to talk about today specifically is around UNICEF Canada and work we've been doing around childhood well-being in this country. So this work started in 2013, 2014, and the original design challenge came from UNICEF's Global Index of Childhood Wellbeing. They rank countries on childhood well-being, and specifically Canada would be included in the rich country part of the index. So looking at the top 40 richest countries in the world. Canada ranks 25th on that list out of the top 40. And that was a very surprising number, and we've been stuck there for a decade. And that things move around, but Canada being, again, one of the richest countries in the world, relatively small population, it was very surprising to Canadians that this is where we were at, or at least it was surprising to government, it was surprising to a variety of different stakeholders. What was interesting, and when we first started this work, we were sent out to engage with just Canadians across the board. Just let's get a sense of, like, where do you think we rank? How do you think we're doing? If you had to guess where you think we rank on childhood well-being, where would you put us? And overwhelmingly, Canadians would say, well, top 3, we're the best country in the world. And we compare ourselves, all my American colleagues here on this call, I apologize, we're very smug up here. And we compare ourselves to the US all the time. And of course, comparing yourself to the US on social measures is not the best comparator. We should compare ourselves to the Nordics, who are always the top of these indexes. But we say, oh, no, we could never be like them. So we will just very smugly be happy that we're better than the US. We're better than the US, they're lower than we are, great, we're good. And also, we must be top 3 because we're the best place in the world, right? Well, no, we're 25th. Well, why? Well, I'm gonna give all the answers because it's all data-based. Well, the data's wrong. My kids are fine. So we have this powerful myth in this country that we are this incredible place, and Canada's a pretty good place, but we're failing our kids across the board. And it is a really big challenge to change that myth, because really at the end of the day, it's a story that we believe. It's at that myth level. And so how do you start changing hearts and minds? So the project originally started looking at how do we design an observatory of childhood well-being. This is a UNICEF intervention that they will do in certain countries. They'll create an observatory. It looks at data about kids, and then it tries to create influence policy change at a national level for kids. And it generally works, and they've got lots of great examples of it working. What we came to realize was that the data argument wasn't winning the argument. When we presented the data, it was just people saying that it wasn't true, or the data was wrong, or it was flawed, or it was someone else's kids. but it wasn't my kids, even though it's everyone's kids. So we began a different kind of journey, and it's a 15-year project to try to change culture in this country, to try to make children more visible in this country and the challenges that they face. So as this project got underway, that first year, we did all the engagement with Canadians, with the public, trying to understand what the actual problem was, why were we stuck, and why couldn't we get anyone seemingly to care. From that, we created a challenge brief that sort of outlined, here is the challenge. And instead of just creating an observatory that would measure things about kids and then try to do policy advocacy, try to influence change at a national level, we created a different vision for the observatory, which was that it would do data work and it would do influence work, but it would also do design work, that we would embed a design lab in it, that we would work with kids and we would make kids the designers, and that would be one of the ways that we would try to create change in the country. So we said that, and then the very next year, the very first thing we did was work on creating a big design lab week. So we were going to invite all of these folks from all across the country together. Here's a set of challenges that have emerged, and let's work on these challenges. So again, very similar to what some of the other folks have talked about. Of course, we didn't have any kids there. And we didn't have any kids there because kids are hard to work with. We involve kids in the process, but we had adults in the design lab from a variety of different organizations, different experts from all across the country, different facets of traditionally what we would think of as childhood well-being. And then we had a bunch of kids that we would go and engage with. So we would do research with the kids, and we would have them participate and provide feedback on the prototypes and some of the things that were coming forward. And it was great. It was incredibly humbling, I think, for some of these experts who, again, are leaders of organizations in this country that are some of the most prominent as it relates to, again, child-serving organizations here, making something and taking it to a group of kids and having those kids say, that's dumb, which was great. Because again, we weren't actually engaging the kids in co-design. We were just asking them to give us feedback on the stuff. And there's nothing wrong with that. But what if the kids were actually there? This was a real turning point in this project, because we realized, we keep getting the same stuff by asking these experts. What we should be doing is getting the kids to tell us what they want, what's important to them. And then using the experts to say, your job's not to tell us why we shouldn't do that. Your job is to help us understand how we might make it happen. How do we actually, if we value what the kids are saying, how do we make it happen? So that was a real turning point. One of the things that came out of that lab was a robot called Welbot. The challenge that they were responding to, that team in particular, was how do we get children as an election issue in the country? So when we look at the top election issues, typically, whether it's a provincial election or a national election, kids are never there. There are things about kids, but it's not really kid focused. It's about getting parents back into the workforce after parental leave. So national childcare and things like that. It's not actually about kids and things that they want. Because kids are invisible, we were wondering how might we actually make them more visible? And one of the ways, or one of the teams came up with an idea called Welbot. I don't know if folks remember Hitchbot. Hitchbot, this was maybe a decade ago. It was a hitchhiking robot. So it was, I don't know, it was like a garbage can and pool noodles, but it had a mechanism that would allow it to ask for a ride. And so people would pick it up and they would drive it around and drop it off. And then it would hitch for another ride and someone would pick it up. And so it traveled all across Canada. And then it got itself down into the US, and then eventually it was destroyed, but it traveled for like a year and a half, and it got lots of media attention. So the team was playing with that idea and saying, well, what if we created a robot that we could have travel to school and talk to kids about their well-being? Would that create attention? If a robot that UNICEF had created, so UNICEF, a brand I've heard of as a Canadian, but they do work overseas, right? Like, why do they don't do work in Canada? Why do they have a robot talking to my kids in their school about childhood well-being? And what are my kids saying? Would we start to see, could we elevate things that matter to kids? Could we elevate their voices and their concerns? And will we begin to see that make its way into more of a public discourse? So the kids didn't care about that at all, at all. What they loved was the idea of making robots they loved making robots. So they wanted to make robots and then send robots out. They thought that was really cool. And they also liked the idea of talking about their well-being, which was great. Welbot, through prototyping and iteration, turned into a chatbot, and that chatbot is active today. UNICEF Canada uses it to poll kids all across the country on issues that, again, are national issues or it could be a provincial issue. And then they use that information and feedback to inform policy briefs that they put forward to the government. So it went from a physical thing that's going to travel around and do all this stuff, and then by working with the kids and actually having them participate in the design process has turned into a chatbot, and now we've got thousands of kids across the country using this. So that was a real turning point in all of this work, but for UNICEF as well, who were realizing, oh, actually, look what happens when the kids are there and in the room. So we then really shifted toward, let's just always involve the kids, and let's make sure that there are more kids involved than adults in these design labs and in these processes. And the next set of things that we were designing and ways that we were now pursuing this work, one was creating a Canadian Index of Childhood Wellbeing. So this was looking at measures of childhood well-being that kids said were important and trying to collect data that, again, was about childhood well-being that the kids said was important, not what the experts say. So the expert stuff is always, let's look at obesity rates and grade levels and days in school, all of these various things. When we ask kids what's most important to them, they talk about things like having a pet. So my cat makes me happy was one of these statements, and it was the title of a report that we ended up authoring through this work. Because when we went out and did the work to design this index, we did a Delphi process where, again, we went all across the country and we were asking children and youth, as well as adults and experts, to rank indicators of childhood well-being. So we had some sense of what should be in this index or not. There were 137 measures that I think were put forward originally, and we were looking for a ranking process to get a sense of what's the most important stuff. Kids, almost across the board, regardless of background, socioeconomic status, would rank always in the top 3, having or caring for a pet. Experts, almost all of them, ranked that dead last, and or sent us angry emails that said, if this is the kind of thing that's going to be included in this whole project is stupid. And so that disparity, kids saying this was the most important thing and experts saying that was the least important thing, was a really, again, powerful moment in this work where UNICEF Canada, rightly so, said, we're going to include that in the index. And if that means someone doesn't want to participate, so be it. But if we're going to honor the voices of kids, if we're going to have them participate in this, and if they're telling us that this is what matters to them, we got to honor that. We have to do that. And so that's part of the index. That index was launched. It's being piloted in a handful of communities across Canada right now. Local governments are using it to collect data differently about kids and with kids, but also they're using it to inform different policy decisions that they're making at a local level. And obviously, so much of this work happens at the local level, like the actual, where we live our lives is the experience that we have, and so much of that impacts our well-being. So the next thing that we created because of that was a youth-centered design toolkit. So taking principles of design thinking and human-centered design and applying that to children and youth and saying, here's how an organization that serves kids that is probably pretty bad at engaging with them, because we find that organizations are pretty bad at working with kids. Even when they serve kids predominantly, they really don't know how to bring them into how might we design a service with you. We're going to design a service for you that we think is the best thing. So the Youth-Centered Design Toolkit is really targeted to organizations that serve children, and it's helping them learn how to bring kids into these processes in a meaningful way. One of the labs that we were doing to explore this toolkit and design it, we were asking kids to, if they could ask the Prime Minister to do anything to improve their well-being, what's one thing that they would have them do? And so we had some of our data scientists in the room because it was all part of the index as well. And one of the kids put forward on a sticky note, I would have the Prime Minister have unicorns everywhere, wherever, like all over the place. And one of the data scientists leaned forward or next to me and whispered, like, this is why this is useless. This is why this doesn't matter, because like, what do we do with that? And this was a 9-year-old girl who put forward this as a legitimate answer to the question that we asked. And one of the things that came out of that was, when do kids stop putting forward ideas like that? When does that stop being a legitimate answer? Because we rip all of the wonder out of their lives. So when does that start to happen? Let's measure those kinds of things. It's not necessarily the content of the answer, it's the nature of the content. And so, again, this has influenced a lot of what's been designed related to this initiative. Another thing that we did was Foresight Work. So looking at possible futures in this country and having kids tell us what they saw as possible futures. When we do this work, we're working with kids as young as 3 up to 18 years old. And for the 3 to 5-year-old set, which as you can imagine is a tricky set to work with on things like this, one of the workshops that we do with kids, it's 20 minutes. So it's an appropriate amount of time to work with a 3 to 5-year-old set. And we'll have them come into a workshop and they will, we've got a big fridge box and we build a time machine. So we're building a time machine and we're going to go to the future and we're going to talk about that future, but we're going to bring something with us that's going to make us feel safe, that's going to make us feel loved, that's going to make us feel comfortable in this future. Because we don't know what the future is going to be like. So the kids can make anything they like. Now, interestingly, a lot of kids make an animal, make a pet, make something, some companion that they can bring with them. So that was just another data point for the index piece. But then we make these things, we go in the time machine, and then we come out and then we talk about the future and we talk about the thing that we brought and why, and we talk about what we hope that future is like. And it's one of the ways that we've been able to inform these foresight scenarios that we've created. And that part of the project is called Canada 2030. And so it's looking at possible futures related to childhood in Canada. And of course, some of them are hopeful and some of them are not, because that's all possible. But that's guiding some of what we're paying attention to as we continue on doing this work.
Brock, we need to start closing up.
Sure, yeah. Well, I was just about to close up, Joanne.
Okay, great, perfect.
Yeah, and the last thing that UNICEF Canada is doing as it relates to this initiative is when they put forward policy briefs to the federal government, they are now starting to engage kids in that. They used to only engage, again, experts. So we, in the last handful of years, we legalized cannabis in this country. And so UNICEF would then advise on what the legal age should be for that. And they would go to experts around all of that, but they also asked kids. And so they put forward 2 different policy briefs, one that was from the kids and what their perspective was, and one that was from the experts. And I think, again, this is UNICEF really living these values of co-design and really allowing and creating space for the kids to participate. So I will end it there.